Thank you very much, Christos. What an introduction. Not at all expected. Thank you very much for having me, for the invitation. It's an honor to be here among you. I have a set of slides. Yes, they are projected. From my side, I'm representing HaDEA, as well pointed out, the Health and Digital Executive Agency. Let's see together, because I feel that this is quite a useful presentation, because yesterday, as the event kicked start, I sensed that the role of the agency was not quite clear. So what the agency does, implements European programs and initiatives on behalf of the European Commission. We manage projects that are related to health, digital, food, industry, and space. Here are our main DGs, our main counterparts that shape the European policy. Of course, here an important representation from DG Santé, and to see how the roles and responsibilities are divided. The European Commission, on one hand, defines the policies and drafts the work programs, and then come the executive agencies to implement the call for proposals and manage the funded projects. In particular, the agency manages a range of programs. We have Horizon Europe, the health strand, the Single Market Program, working for food safety. Under the digital strand, we have on one side the Horizon Europe Digital, the Connecting Europe Facility Digital as well, and the Digital Europe Program. Under industry, you see Horizon Europe and under space as well. A glance of the total budget that we manage, around 20 billion, and a great share goes to EU for Health. Indeed, we're working with a wide range of beneficiaries. From the side of EU for Health, mostly member state and national authorities. But the range of the programs managed by HaDEA indeed reach the academia, international organizations, NGOs, representatives of civil society, and the industry. For EU for Health, the areas of intervention, not only digital, of course, cancer, crisis preparedness, health promotion and disease prevention, health systems and healthcare workforce, and digital, of course. As Mrs. Raffaeli mentioned earlier, indeed there are different types of grants that are managed under the EU for Health program. You are well aware of the direct grants to member states. These are direct invitations that the member states receive, and then they need to nominate a competent authority to implement a joint action or a direct grant. Of course, direct grants to bodies already identified by the Basic Act. HaDEA sends the invitation directly to the specific entity, and of course the specific entities are as defined in the call text. Then the open call for proposal, these are competitive calls. They are launched by HaDEA and published on the Funding and Tenders portal. There indeed under the competitive calls, you see a wider range of beneficiaries that are interested. HaDEA implements the EU for Health based on annual work programs. You have also a barcode here if you want if you're interested in checking the different annual work programs, the 2024 in particular. You see a glance of the policy priorities and key initiatives, and a significant share that is supporting the European health data space. Of course, under the digital strand, with the amendment of the work program has been significantly reinforced. You can identify the primary uses of health data in the proposed European health data space, under which the recent call for the recent direct invitation for the direct grants to member state, expanding the My Health at EU. And also you see here the very popular, I might say, open competitive call for promoting the uptake of artificial intelligence in health. And then let me show you a timeline that was used by DG Santé previously to illustrate the European health data space implementation, where you see that we have come a long way since 2021. Already at the level of inception of the European health data space, you see CEF Telecom projects from Connecting Europe facility. You see, of course, Horizon Europe important projects going in that direction. Very important projects that we see here well represented as well, projects that have been previously mentioned by DG Santé as well, such as Xt-EHR, Potential, EHDS 2 pilot, of course. We have community of practice, and what we need, it is important to see here is the synergetic approach, of course, and the complementarity between the projects. It is important that each one of you is not working in silos, and that you are benefiting from the results already available from other EU-funded projects. In any case, you're all working with the same vision and with the same objective. Yes, the 2024 EU for Health calls have been recently closed, so I'm not here to announce an open call and promote your interest, but I can say that indeed they were very successful. And we have received a lot of proposals. Some interesting communication links, if, of course, I invite you to stay in touch with us, and we are here to reply to any question you may have. Thank you.